You know what question I've been getting asked a lot lately? Dr. Garrett, what about CoQ10 for tinnitus? I saw something online about it helping with ringing in the ears. And honestly, it's a really good question because unlike a lot of supplements that people try for tinnitus, and trust me, I've seen patients show up with bags full of random stuff they bought on Amazon, CoQ10 actually has some legitimate research behind it. But here's the thing, it's not a magic bullet. It's not going to cure your tinnitus and it doesn't work for everyone. So today, let's talk about what CoQ10 actually is, what the research really shows, and who might actually benefit from trying it as part of a comprehensive treatment plan. All right, so before we dive into CoQ10 specifically, we need to understand something about how tinnitus works at the cellular level, and I promise I'll keep this simple. One of the pathways that can contribute to tinnitus involves something called oxidative stress. Think of oxidative stress as like rust on a car. It's basically cellular damage that happens when your body's antioxidant defenses can't keep up with all the free radicals that are floating around. Your inner ear, specifically those delicate hair cells in your cochlea, are very vulnerable to this kind of damage. They're working hard all day, every day, converting sound waves to electrical signals that your brain can understand. And that work requires a lot of energy, which means a lot of mitochondrial activity, which means a lot of potential for oxidative stress. When those hair cells get damaged, whether from loud noise exposure, aging, medications, or just accumulated stress over time, that's when you can start experiencing tinnitus. The damaged cells send abnormal signals to your brain, and your brain interprets that as sound even though there's not actually an external sound present. Now here's where it gets interesting. Research shows that people with tinnitus often have higher levels of oxidative stress. It's like their cells are dealing with more rust than they can handle. And that's exactly where antioxidants come into the picture. So what is CoQ10? It stands for coenzyme Q10, and that's actually something your body naturally produces. It's not some exotic herb from the rainforest, it's literally in every cell in your body right now. CoQ10 does two really important things. First, it's a key player in your mitochondria, those little power plants inside your cells that produce energy. Without enough CoQ10, your cells struggle to make the energy they need to function properly. Second, it's a powerful antioxidant. Remember that cellular rust we talked about? CoQ10 helps prevent and repair that damage. Now here's the catch. As we age, our natural CoQ10 levels decline. By the time you're in your 50s, 60s, or 70s, which not coincidentally is when most people develop bothersome tinnitus, your CoQ10 levels might be significantly lower than they were when you were younger. And if you're taking statin medications for cholesterol, these can further deplete your CoQ10 levels. Same thing if you've been exposed to loud noise over the years, or if you're dealing with a lot of stress, poor sleep, or other health conditions that increase oxidative stress. Now, if you're finding this helpful and you want more evidence-based information about tinnitus and hearing loss without the hype or pseudoscience, go ahead and hit the subscribe button and turn on notifications. We break down the actual research on what works and what doesn't for tinnitus nearly every week. So what does the actual research about CoQ10 say about tinnitus? A review article that was just published in late 2025 in the SBV Journal of Basic, Clinical, and Applied Health Science looked at 49 different studies on this topic. Now I want to be completely transparent with you. We're not talking about massive gold standard clinical trials here. Most of these are smaller studies, case reports, and case series, so we need to take these findings with appropriate caution. But here's what consistently showed up in the literature. For patients who have low CoQ10 levels, to begin with, supplementation can reduce tinnitus loudness and annoyance. We're not talking about making the tinnitus disappear, we're talking about improvements about how bothersome it is. The improvements tend to show up in three areas. First, some reduction in the actual perceived loudness or intensity of the tinnitus. Second, better sleep quality. And third, reduced fatigue. And here's what's interesting about these last two. Better sleep and less fatigue indirectly make tinnitus less intrusive even if the volume hasn't changed dramatically. There's also some evidence that CoQ10 can protect the cochlea from ototoxic damage. For example, patients undergoing chemotherapy, which is known to cause hearing loss and tinnitus, had better outcomes when they supplemented with CoQ10 during their treatment. And in animal studies, CoQ10 has been shown to protect cochlear hair cells from noise damage and oxidative stress. So the mechanism makes sense, and we're seeing some of the clinical benefit in the studies we now have, But, and this is important, we need more research with larger sample sizes to really nail down who benefits and what the best protocols are. I want to be clear about something though. The American Academy of Otolaryngology Head Neck Surgery, the AAOHNS, which publishes the clinical practice guidelines for tinnitus, does not currently recommend any nutritional supplements, including CoQ10 as a treatment for tinnitus. And that's important context. The official guidelines are based on the highest levels of evidence available, and right now, we just don't have enough large-scale randomized controlled trials on CoQ10 that meet that bar for guideline inclusion. That doesn't mean that CoQ10 doesn't work or that you shouldn't consider it. It just means we need to be honest about where the evidence currently stands. What we have is emerging research that shows some promise, particularly for specific patient profiles, but it's not yet at the level where medical organizations are going to say, yes, this is a recommended treatment. So when I talk about CoQ10 as a potential option, I'm talking about it as an optional addition, something low risk that you might try as part of a broader approach, not as a primary treatment or a guideline-endorsed therapy. Now with that context in mind, let's talk about who might consider trying CoQ10 for tinnitus. Based on the research we have, the best candidates are people with chronic subjective tinnitus who fall into one or more of these categories. If you have noise-induced hearing loss, maybe you worked in construction, served in the military, attended a lot of concerts in your youth, or just have years of cumulative noise exposure. If you're dealing with significant stress, poor sleep, or fatigue, remember these factors increase oxidative stress and they also help create a vicious cycle where tinnitus gets worse, which causes more stress and more sleep problems, which then makes tinnitus worse. If you're older, say over 55 or 60, because CoQ10 levels naturally decline with age, it might be an option. Or if you've been exposed to ototoxic medications, not just chemotherapy drugs, but also certain antibiotics, high doses of aspirin, or other medications known to affect hearing. And honestly, if you're someone who's already asking about supplements and doing your own research, I'd much rather you try something like CoQ10 that actually has at least some evidence behind it, rather than wasting money on supplements that have zero scientific support. All right, so if you're thinking about trying CoQ10, here's what you need to know. The typical dose in research ranges from 100 to 300 milligrams per day. Most of the studies used 200 milligrams, which seems to be the sweet spot. You can split that into 2 doses of 100 milligrams, once in the morning and once in the evening, which actually does help with absorption. Don't go over 300 milligrams per day. More is not better, and higher doses actually increase the risk of side effects like insomnia. Speaking of side effects, CoQ10 is remarkably safe. The most common issues are mild, maybe some digestive upset, or ironically, sleep disruption if you take it too late in the day. But there have been no serious adverse effects reported in the literature. And here's the timeline. Don't expect results overnight. The studies show that benefits typically started for people who've been using it for 8 to 12 weeks. That's not a quick fix. And here's something I can't stress enough. CoQ10 is not the treatment plan itself. It's something that you add to a treatment plan. If you have hearing loss, you still need properly fitted hearing aids. If you're dealing with the emotional and cognitive aspects of tinnitus, you still might need some cognitive behavioral therapy-based strategies. And if you're a candidate for like veneer, CoQ10 does not replace that. Think of CoQ10 as supporting your cell's ability to handle stress and function properly, which may reduce the neural hyperactivity that's driving your tinnitus. But it's just one piece of a very large puzzle. Here's how I think about CoQ10 in our practice. We always start with the fundamentals, the things that actually have strong guideline support. If you have measurable hearing loss, we need to address that first with properly programmed hearing devices using real ear measurements to verify the prescription, because that alone can significantly reduce tinnitus for many people. We also incorporate sound therapy strategically, not as the hero treatment, but as supportive care for sleep and temporary relief from your tinnitus. We then provide structured education and cognitive behavioral therapy-based tools to help you manage the stress and emotional response to tinnitus, because we know that's critical for reducing how much tinnitus bothers you. And for patients who need more, we might add that linear bimodal neuromodulation to target the neuroplasticity component to treat tinnitus. And then for patients who fit the profile, especially if you're dealing with high oxidative stress, poor sleep, fatigue, or you just really want to optimize every aspect of your treatment, we might discuss adding CoQ10 to the mix. It's low risk, relatively inexpensive, and might give you that little extra 5 to 10% improvement that can make the difference in your quality of life. But again, we'll never say CoQ10 is take this pill and your tinnitus will go away. It's presented as this might help support your cellular health and reduce some of the underlying mechanisms that are contributing to your tinnitus, but then reminding you it's not a replacement for any evidence-based treatments. So bottom line, is CoQ10 worth trying for tinnitus? If you fit the profile we talked about, chronic tinnitus, noise exposure history, older age, high stress, or poor sleep, then yes, it's a reasonable option to discuss with your audiologist or healthcare provider, keeping in mind that it's not currently recommended as a primary treatment by any medical organization. It's not going to cure your tinnitus, it's not going to work for everyone, but for some people, especially those with low CoQ10 levels or high oxidative stress, it can be a helpful piece of a comprehensive treatment approach. And that's really the key word, comprehensive. Tinnitus is complex, and effective treatment usually requires addressing multiple pathways: the auditory system, the central nervous system, the stress response, sleep, and potentially, yes, cellular and mitochondrial health of your cochlea. Now I'm curious, have any of you tried CoQ10 for your tinnitus? Did you notice any improvement? Drop a comment below and let me know about your experience. It really helps other viewers who are trying to figure out what might work for them. If you want to learn more about hearing loss and tinnitus, the science behind it, the treatment options that actually work, visit our online learning center. The link is in the description below. We've got a lot of free resources, articles, and videos to help you understand what's happening and how to address your needs. And if you're struggling with tinnitus and you want to explore evidence-based treatment options, that's exactly what we do here at Timpanogos Hearing and Tinnitus. We take a systematic, multimodal approach that's grounded in the research, customized to your specific situation and focused on real, measurable improvements in your quality of life. If you're in Utah, you can schedule a comprehensive tinnitus evaluation online. The link is in the description. Let's figure out what combination of treatments will work best for you. Thanks for watching. I'll see you in the next video.